Skin cancer is the most common type of cancer in the world. Approximately 1.5 million new cases are diagnosed each year, so it's really important to know how to protect your skin. And today we have Chris Stoner and Doug White here, both nurse practitioners with Franciscan Health. Thank you both for being here.
Thanks for having us.
Appreciate it. So right off the bat, how do you know if somebody's high risk?
Well, it depends on a few factors, but as we get older, we're at a higher risk to develop skin cancer, skin lesions. Family history of skin cancer, too, is up there. Fair complected people have kind of a higher affinity for skin cancer and issues like that, too. And then if you just have a history of being out in the sun without sun protection, tanning beds, those are another thing to think about.
What can we do to prevent getting skin cancer?
Number one thing is wearing sun protection. So if you're going to be out in the sun, wearing an SPF 30 or higher, and kind of is recommended to apply every 2 hours. If you're going to be doing things like swimming, a lot of sweating, applying that more often than the 2 hours.
What should I be looking for on my body, and how often should I be looking for it?
Yeah, I think that's a good question. At least once a month, kind of look, see what's going on. It's hard to see behind, so if you've got somebody that can look there, look into a mirror to check too. But you're looking for new lesions that are popping up fast, growing. We talk about the ABCs, you know, of skin lesions.
Like when you look at a skin lesion, the A is asymmetry. So if you draw a line through the middle of the skin lesion, does it look the same on both sides? B is for border. Does the border look scalloped looking or just irregular looking? Color, is that color changing? Is it darker on one side versus the other? And then diameter. Kind of anything that's over 6 millimeters is something you want to get looked at by a professional.
And to put that in perspective, what is that? 6 millimeters?
About size of a pencil. Pencil eraser.
Gotcha.
Head of a pencil eraser. So, and then E is evolving, kind of that change in color, size, shape of a lesion. And that's kind of one thing we always kind of stress at our annual visits with patients. We ask them, do you have any new skin lesions or moles or anything that's changing with your skin?
Annual visits are important, but then when we find something that is troubling from those
Correct,
ABCs?
Yeah, I think honestly, if you find something, it's a good idea to probably ask your primary care about it, to check it out. If it looks odd, just like anything with healthcare, if something seems off, say something about it.
All right.